Here are 3 USMLE-style multiple-choice questions based on decreased B cells and susceptibility to encapsulated bacteria, incorporating the mnemonic, "Please shine my skis." Question 1. A 2-year-old boy presents with recurrent otitis media, pneumonia, and sinus infections. Laboratory evaluation shows decreased serum immunoglobulins and absent CD19 plus cells. Flow cytometry confirms the absence of mature B cells. Which of the following pathogens is he most at risk of developing severe infection from? A. Mycoplasma pneumoniae. B. Staphylococcus aureus. C. Haemophilus influenza type B. D. Candida albicans. E. Bordetella pertussis. Haemophilus influenzae type B. Explanation. The child has a B-cell immunodeficiency, e.g. X-linked amyoglobulinemia. Patients with HAT B cells can't make antibodies, which are critical for clearing encapsulated bacteria, like H. influenzae type B. Mnemonic, please shine my why not the others. A. Mycoplasma lacks a cell wall, not encapsulated. B. S. aureus can cause infections but not classically associated with B-cell deficiency. D. Candida, fungal infection, more likely in T-cell deficiencies. E. B. pertussis, toxin-mediated, not an encapsulated organism. Question 2. Which of the following combinations best represents bacteria that pose increased risk in a patient with impaired humoral antibody immunity? A. Staphylococcus aureus, Listeria monocytogenes, Candida albicans. B. Neisseria meningitidis, Streptococcus pneumoniae, Escherichia coli. C. Clostridium difficile, Mycobacterium tuberculosis, Pseudomonas aeruginosa. D. Bacteroides fragilis, Mycoplasma pneumoniae, Corynebacterium diphtheriae. E. Treponema pallidum, Borrelia burgdorferi, Salmonella typhi. Correct answer B. Neisseria meningitidis, Streptococcus pneumoniae, Escherichia coli. Explanation. All 3 are encapsulated organisms and fall under the Please Shine My Skis mnemonic, which includes P. pseudomonas, Streptococcus pneumoniae, Haemophilus influenzae type B, influenzae, Neisseria meningitidis, Escherichia coli, Salmonella, Klebsiella, Streptococcus group B. Why not the others? A, C, D, E. Include non-encapsulated organisms or pathogens not primarily associated with humoral immunity defects. Question 3. A 10-month-old infant has recurrent respiratory tract infections and meningitis. His peripheral blood shows undetectable levels of IgA, IgG, and IgM. Flow cytometry reveals the absence of CD19 plus cells. Which of the following vaccines would be least effective in this child? A. Inactivated polio vaccine. B. Live attenuated MMR vaccine. C. Conjugated Haemophilus influenzae type B vaccine. D. Hepatitis B surface antigen vaccine. E. Tetanus toxoid vaccine. C. Conjugated Haemophilus influenzae type B vaccine. Explanation. This child has a B-cell immunodeficiency, making him unable to produce antibodies effectively. While the conjugated Hep B vaccine is T-cell dependent and generally more effective than polysaccharide-only vaccines, it still relies on functional B cells to generate a protective antibody response against encapsulated organisms. Why not the others? A. Polio, inactivated, mainly generates cellular immunity, may still offer some protection. B. MMR live, risky in T-cell deficiency, but B-cell deficiency may allow partial immunity. D. Hep B and E. Tetanus toxoid are protein antigens can elicit some T-dependent immunity, may work suboptimally but still better than a polysaccharide antigen in pure B-cell absence.